MidconceptionsMedia.com.
It's filled with local news, sports features, and schedules
Whenever you want it.
podcasts, pictures, videos, and more, all at WHBC.com.
You can put your debit card away. We're free.
Just turn us on. It doesn't cost anything. 1480 WHBC.
Time for us to have another wonderful chat with our favorite family physician, Dr. Stan Anderson. He is on our WHBC Newsline right now. Good morning, Dr. Stan.
Hey, Pam. Great to talk to you.
Well, I think this is a very timely topic that we have chosen because, and there are so many questions. I don't care who you ask. People always have questions about, Medicare coverage, open enrollment, and all those things.
Yeah, and it just opened up 12 days ago. So people are now talking with their insurance agent, and they're trying to come up with a strategy, a plan, which one is best, which one is going to be the best for me. So the short answer is you kind of need to look at your situation, and you need to decide which of the different available plans is going to cover all of your needs or the greatest majority of your needs. So people who prefer to go through one hospital system compared to another should also be aware that there's certain insurance coverages that don't cover well at certain hospitals. So if you have Primetime or Alt Care and you want to go to Mercy, then you're going to have a much higher copay. So you should look at your insurance company in order to determine which hospital system. So if you have Humana, that's not covered at Altman. So the two simple, at least, categories that I would say, if you're thinking that I'm primarily going to be using the specialists and the hospital system that's at Altman, you should avoid the insurance companies that don't go to Altman, specifically Humana. For the most part, almost all of the other ones do. And if you specifically want to stay with Mercy, then you should probably avoid Alt Care or the Primetime, only because your copay is going to be higher if you go out of network. Those are the simple things that I would say. That's the first thing that you want to look at. Look to see where your specialists, where your hospital primarily is, and you want to make sure that your insurance basically covers almost all of that. Every other insurance, almost, is, so you want to talk this over with your insurance agent, but almost every other insurance allows you to go to any other hospital system, which kind of puts you in an interesting situation. So if you have, say, SumaCare, and you go on vacation, you need to know if you're going to go to Florida for the winter, does SumaCare cover what is your out-of-network costs if you go to Florida and you have to be seen or you have to be hospitalized or there's some emergency? That's the real issue. Those are the questions you want to ask your insurance agent, not just what's in it around here, but also what would it be like if I'm out of this the state and something happens. And so those are the questions you want to ask.
Yeah, that's very good information. I didn't even really think about the snowbirds, traveling to different places. And there are a lot of misconceptions out there, though, too, aren't they? I know you like to be a myth buster.
Well, part of it is this. If you think about how many people are uninsured, we're now at around 8% of all Americans over the age of 18 are uninsured. That's better than what it used to be. It was closer to 19% back 20 years ago. So this is much better. There's a lot of questions about what's going to happen with government subsidized insurance in the future and how that's going to work. Nobody really knows. So at this point, the question is, all right, what is the important thing that I need to do? So first and foremost, think about the word insurance. Insurance is if there's a problem. Many of us live lifestyles that are not healthiest. So as a result, it's not if something happens, but when something bad happens. And getting in, the cost of healthcare has just risen dramatically. The stories of people that are admitted to the hospital with no insurance and the bills that they get afterwards are just, they're mind-blowing. Oftentimes people will go in for one night stay and they're going to come out with a $10,000 to $20,000 bill. And part of that is the cost of healthcare has dramatically risen. The hope is as we have more transparency and people get to see, all right, these are the charges, these are the risks, so maybe I can start to maybe go to this place for a CT scan instead of the hospital system, or maybe I can see this provider instead of the other. That's the whole key, is to try to be a savvy customer. Think of your healthcare as something that you need to take more aggressive action to try to come up with the least expensive, the one that has the least financial outcomes that are going to hurt you.
Yeah, and they call it open enrollment because it's now through, I think, December 7th. You have to make the choice right now, right?
Yeah, so the idea is that if you miss that deadline, you're going to end up having some complications. Again, that is something that your insurance broker is going to talk with you about. The most important thing that I would tell people is, one, you decide based on who the providers are that you like. So stay with your primary care provider. If your primary care provider does not take the insurance you want, you have a choice. Do you really want that insurance? Go with something else. The second thing is knowing which hospital system you're going to go through. So again, if you really like Altman and you've been going there forever, you really want to avoid Humana because that one is not going to be covered. It's going to throw a big monkey wrench. Similarly, with SumaCare, that if you go to a different hospital rather than one of the Suma approved, you're going to end up having a worse outcome financially, that is. And the other thing is this. Many healthcare providers are in their mid-60s, and they're probably going to retire. So if you've been always going to someone, and they're now, they haven't said anything, but they're thinking of retiring in the next month or 3 months, now that's a whole nother monkey wrench, because now you've got to start all out from the beginning. Who are you going to see? So a lot of unknowns, a lot of questions. The bottom line is you want to sit, talk with your insurance broker, and talk with your healthcare provider. That's my best recommendation.
I love it. That's great stuff. Be prepared. Ask questions. All right. I'll ask you more questions next week. How's that sound, Dr. Stan?
Oh, Pam, I look forward to it. Thank you.
Doctor, I'm screaming out.